Yeah, Dr. Peter Osborne, and I'm the founder of Gluten Free Society and the CEO of Origins Healthcare.
I was going to ask you, what percentage of kids do you think being diagnosed these days with ADD, OCD, behavioral issues are actually nutritional deficiencies or result of some kind of food allergy in your estimation?
100%. I think that's part of the problem. I think the problem with a lot of kids growing up early is that number one, they're born nutritionally deficient because their parents, are just the same way as it goes back to farming. So we farm from eroded soil. We produce an inferior food. We feed that inferior food to pregnant mothers. Pregnant mothers then have gestation issues, and that child is born nutritionally deficient. Most mothers opt out of breastfeeding. I shouldn't say most, but many do. And now what we're feeding them is a concoction of basically genetically modified corn syrup with vitamins, and that leads to early onset of very poor health and the increased risk for the development of a number of different types of problems. And when you combine that with food allergies and you combine that with today the vaccine schedule, which at one point, prior 1983 was relatively minimal versus the 87 doses that children receive up to the age of 18 today. You're injecting chemicals in an attempt to create health, and that doesn't make sense. That doesn't resonate. It scientifically, it's unsound, and it's never really been proven to work. And it has been proven that many of these adjuvants in vaccines, like mercury and cadmium and aluminum and a number of the other preservatives, actually do have neurological detrimental effects. And so we have this cascade of events of poor nutrition, malnutrition, poor food sources, ingestion of chemicals. And we're not even talking about food chemicals at this point, because many of the food items that people choose to eat are highly processed foods. So you get things like MSG and food colors and food dyes and preservatives. And so what we're facing is a massive epidemic of malnutrition and overburdening of chemical exposure. Of course, the brain's going to malfunction. Of course, the health is going to deteriorate in these young kids trying to develop. Well, I mean, my clinic is based on people that seek me out.
Mhm.
So I could see the conundrum where many doctors who don't understand nutrition, don't appreciate nutrition, if they tried to bring up those types of topics to your average person who doesn't want to hear it,
Mhm.
they probably are going to get a lot of pushback. But my clinic is designed in such a way that the people that need help, that want help, come and have a place they can get it. In essence, I don't advertise. It's not something that I believe in, because I feel like if you're trying to convince people of something, of a message they're not ready open to hear, it's kind of like an alcoholism or drug addiction.
Yep.
If you can't admit that you first have a problem, then there is no solution.
Right.
And it's the same thing with chronic health issues.
Yep. Very true. Um, yeah, let's see. Could you talk a little bit about how diet can create a lack of amino acids for brain chemicals?
Yeah, absolutely. So a lot of children, a lot of adults today are eating a very high carbohydrate diet. 70+% of the average American's diet is carbohydrate. And it really should be closer to, 40%, 30, 40% carbohydrate. Now, why does that matter, and why is that important for amino acids? If we're consuming the vast bulk of our calories from carbohydrate, then there's not enough left. There's not enough room, caloric room left for actual amino acids, the building blocks for neurochemistry. So for example, if their body is trying to produce and make dopamine, which is a very important chemical as it relates to addiction physiology, you've got to have tyrosine.
Mhm.
The bulk of tyrosine as an amino acid is going to come from animal-based meat products, not from vegetarian or plant-based products, and certainly not from what most Americans eat, which is largely processed, condensed and processed food. You've also got other neurotransmitters like tryptophan. Tryptophan is an amino acid that converts into serotonin. Serotonin is very important for the calmative effect on the brain and for mood. And so serotonin and dopamine, both those deficiencies, can contribute to an increased development or an increased risk of addiction and mood disorders that lead to that lead to addiction. So, for example, depression. People that are depressed have a greater tendency to pull, to pull for medication or to pull for self-medicating, right? And whether that's a prescription drug or whether that's a street drug, they're looking for something to saturate those neuronal receptors in their brain because their body doesn't have the amino acids necessary to produce that substance to give them that need.